Welcome to this lesson on blood coagulation. Blood coagulation is a hemostatic mechanism, one of three processes that stops blood loss from damaged or ruptured blood vessels. The other two are vasoconstriction and platelet plug formation. Coagulation results in the formation of fibrin threads that trap blood cells. There are 13 coagulation factors in blood plasma. Factor 1 is fibrinogen. Factor 2 is prothrombin. Factor 3 is thromboplastin. Factor 4 is ionic calcium. Factor 5 is hereditary labile factor. Factor 7 is proconvertin, or serum prothrombin conversion accelerator. Factor 8 is antihemophilic factor. Factor 9 is Christmas factor. Factor 10 is Stewart factor, or Prower factor. Factor 11 is plasma thromboplastin antecedent. Factor 12 is Hageman factor. And factor 13 is fibrin stabilizing factor, also called fibrinoligase. The mechanism of coagulation. Several factors called clotting factors are involved in the clotting mechanism. These factors are present in inactive forms called zymogens. When a factor is proteolyzed, it gets activated. This activated factor catalyzes the activation of larger amounts of the next factor in sequence. Hence, the coagulation cascade gets amplified at each step. Several factors called clotting factors are involved in extrinsic, intrinsic, and common pathways. The extrinsic pathway initiates within seconds after tissue trauma. It is initiated by tissue factor, a transmembrane protein called thromboplastin. Tissue factor activates factor 7 to 7A. The TF7A complex then activates factor 9 and factor 10. This pathway is fast and results in the formation of prothrombinase. The intrinsic pathway is initiated when factor 12, the Hageman factor, comes in contact with a negatively charged surface, such as glass. It is a slow pathway, taking several minutes. Factor 12 activates 11, 11 activates 9, 9 with 8A activates factor 10. Both pathways converge to a common pathway. In the common pathway, factor 10 activated combines with factor 5 and calcium ions to form prothrombinase. Prothrombinase converts prothrombin to thrombin. Thrombin converts fibrinogen to fibrin. Factor 13, activated by thrombin and calcium, stabilizes fibrin into a sturdy clot with fibrin fragments.
Role of ions in blood coagulation. Calcium ions play the most critical role. Ionic calcium ions are required for the functioning of tenase and prothrombinase complex. Calcium ions are present at various stages in the coagulation cascade and act as a cofactor. Calcium ions play a vital role in the formation of intrinsic and extrinsic factors, specifically XA and IXA. Calcium also binds platelets to the phospholipid surface to aid clotting. Potassium is essential for blood coagulation. It is required for synthesizing 4 clotting factors, 2, 7, 9, and 10. Vitamin K is obtained from the intestine, where it is produced by inhabiting bacteria. Both absorption of lipids and vitamin K go hand in hand, so any decrease in lipid absorption results in vitamin K deficiency. Moreover, excessive usage of antibiotics may also prove harmful by killing intestinal bacteria, which results in reduced production of vitamin K and therefore uncontrolled bleeding.
Inhibition of coagulation. The coagulation cascade is controlled by inhibitors, without which all the blood in the body would get coagulated. Various mechanisms and substances play a role in controlling such clot formation. Antithrombin III is one of the most important endogenous anticoagulants. It inactivates the activated clotting factors 2A, 9A, 10A, 11A, and 12A. Heparan sulfate is a cofactor that enhances antithrombin III activity. Prostacyclin, or PGI2, is an antagonist of platelet aggregation, produced by endothelial cells. Protein C and S are also endogenous anticoagulants that inhibit factors 5A and 8A. Thrombin also activates factors 7, 8, and 11, and as a platelet activator, it stimulates smooth muscle contraction. It also acts as an anticoagulant by activating protein C. Factors delaying clotting include storing blood samples at lower temperatures. Fibrinogen is an important clotting factor. It must be present in blood. Calcium ions in blood can be inactivated by adding sodium citrate or oxalate, thus preventing clotting. Disorders of coagulation. There are 13 known coagulation factors in blood plasma.
Lack of any of these results in bleeding disorders. Coagulation disorders can be hereditary or acquired. Hemophilia is a group of genetic disorders in which the body's ability to control clotting is impaired. Hemophilia A is the most common, found in 90% of hemophilic patients, caused by lack of clotting factor VIII. It is an X-linked genetic disorder. Hemophilia B is caused by lack of factor IX. It is less severe, with a prevalence of about 1 in 34,000. Hemophilia C is caused by lack of factor XI, an autosomal recessive genetic disorder. Although females can inherit the defective gene, they do not develop the disease because they must receive 2 deficient X chromosomes. Von Willebrand disease is the most common congenital coagulation disorder. It affects platelet aggregation and the intrinsic coagulation pathway. Signs and symptoms include excessive bleeding from wounds, spontaneous bleeding, defective platelet aggregation, epistaxis or nosebleeds, prolonged bleeding following trauma and surgery, and gastrointestinal hemorrhage.
Acquired coagulation disorders. Vitamin K deficiency is a common acquired disorder. Vitamin K is a fat-soluble vitamin necessary for the synthesis of clotting factors 2, 7, 9, and 10. Neonatal hemorrhagic disease of the newborn arises due to lack of gut bacterial synthesis and low quantities of vitamin K in breast milk. In children and adults, vitamin K deficiency results in hemorrhagic disease due to malabsorption, inadequate intake, or loss of storage site due to liver disease. Liver disease is also important since hemostasis is intimately related to liver function. Most of the coagulation factors are synthesized and metabolized by the liver. Liver disease decreases the levels of activated coagulation factors, particularly vitamin K-dependent factors, prothrombin, factor 7, 9, 10, protein C, and protein S. Fibrinolytic defects. Fibrinolysis plays an important role in regulating the coagulation mechanism. However, excessive fibrinolysis inhibits the formation of fibrin clot and leads to bleeding disorders. Disseminated intravascular coagulation, or DIC, is a complex systemic thrombohemorrhagic disorder characterized by formation of intravascular clots and deposition of fibrin in tissues. It occurs as a complication of severe shock, trauma, septicemia, and acute pancreatitis, among others. This concludes our lesson on blood coagulation. Remember the key steps. Tissue damage triggers either the extrinsic or intrinsic pathway, both converging to produce thrombin from prothrombin, which finally converts fibrinogen into a stable fibrin clot.